So what is cash-based rehab? In our 3 phases of the clinic gym hybrid model, first phase is exercise. You got to give every one of your patients exercise every visit. If you don't do that, everything I'm talking about today is going to be incredibly hard. We'll start out exercise. The second thing is the trainer as a CA. What does that mean? You start taking that trainer, teaching them everything you know, and they start helping you with rehab. And after a few months, they can do rehab on their own. And what you want to move into is that your patients are scheduling appointments with your rehab, your CA/trainer, your rehab staff. They're scheduling appointments with them, and you as the provider never see that patient that day. So let's just say you have a care plan that's at 20 visits, right? That might be 8 visits with the doctor. So early on, it's 3 visits a week. Then week 2, you're going to add in one visit with the trainer. By week 5, maybe they're more with the trainer and you're just seeing that patient 1 time a week. Work out the numbers. I'm just spitballing here, but you want to get into the area where they're doing cash-based rehab, meaning the trainer, the CA/trainer, is taking them through rehab for about an hour long, and the patient is paying cash for that service, and they are never encountering you. Now, this can be done under the umbrella of the care plan, right? The care plan is up to you as the doctor. The care plan is different than the financial plan. So if you're charging insurance for those visits with the visits for the chiropractic visits, you need to check your state laws and whatnot if this can qualify as supervised care. In some states, supervised means that you've trained the individual and that they can contact you. For example, in the state of Nevada, a PA, physician's assistant, is considered supervised as long as they have, what is it called? It's the silliest law in the world. It's supervised as long as they have one-on-one contact with the doctor. What does that mean? It's been defined in our state as the ability to fax, call, text, or email the doctor within 24 hours of seeing that patient. I mean, the doctor could be in Hawaii and the PA could be here in Vegas, and it counts as, supervised. Anyways, check with your local state laws. I know that some people in the group, they have very strict state laws. And in our Facebook group, when I say that, they have very strict state laws, which means the doctor must maintain a line of sight to anybody providing care under that treatment plan. So that means you need to treat that person and be able to watch. Now, if that's you, I'll get to that in a second. Some states just say, hey, the person is trained by you and they can reach out via call, text, email if anything goes wrong, or the doctor, some states say the doctor needs to see the patient more than 30% of the time, aka a third of the visits need to be with the doctor, sometimes even less than that. Whatever it is, make sure it's compliant with your local laws. But once it is compliant, maximize that stuff, man. Crank it up. Like, do everything you can to you want to get as close to that legal limit and the scope as you can. I think a good example of that would be like surgeons. Surgeons don't take vitals. They're allowed to, right? Their scope includes vitals, but they're like, hey, listen, I'm going to just do the cutting and sewing because that's what I'm paid to do, right? And they let a medical assistant take the vitals, or a nurse or somebody else in that state. So they're maximizing their license. That's why at the end of every one of these episodes, I say, go out there and maximize your license. Use the hell of that license as far as you can. Because there's money to be made. There's profit to be made when you maximize your license. But when you tamp it down as you're the only person that can provide hands-on care, you're the only person that can provide rehab, man, you're just stomping on all your profit. Anyways, what would I do if I had a state scope that required me to maintain line of sight? I'd tell you this. So once you have a gym, you'll realize this, and I encourage you, talk to anybody that has a clinic gym, and they'll tell you that this happens all the time. You can treat many people out there on the gym floor. In fact, I would put some tables out there and I'd mount them on those floor sliders, those little slick things, super easy. You can push them to the side during classes and pull them back out. I would treat in the open gym area most of the time, probably 80% of my visits. I would probably do all my new patient exams in a private room. Why is that? Well, it allows me to maintain line of sight. If I'm in there and my CA/trainer is over in a different corner, I just need to look over there and I can maintain that line of sight with them at the time, right? And what you'll realize, it's very efficient to provide care in the gym setting. It's super efficient. And most people, barring like, you know, I always say like dry needling somebody's glutes, I wouldn't do that in an open gym bay. It's just not, you know, it's not nice. So you want to provide a little bit more respect than that. However, I think most of 80 to 90% of the stuff we do, adjusting, soft tissue work, early rehab, history, physical exam, run movement exams like the SFMA, all that can be done in that gym space. And again, you're getting over that psychological hump of them being in that space. So I would consider that if I was restricted to that line of sight issue. But either way, I think it's important. Number one, look at your hours of when people are already coming in your clinic. Use that as a guide. Number two, if running gym classes will impede or interfere with the clinic, then find times that you can window them as close to those desired times as you can. Number three, find out your perfect patient. Who is the perfect patient you want? And then set up classes to serve that person. Again, if it's marathon runners and triathletes, they like to work out in the morning, bias your gym times towards morning workouts. Number four, check your local state laws to make sure that what your scope says about using a CA and trainer. But once you find that out, maximize your license, use the hell out of them. And number five, modify as needed to have that, because the goal is that when you don't have classes, that gym space is being utilized for cash-based rehab. It's just another revenue source that's really going to push you over the edge. And it's so awesome to make money in a practice when it's not your hands that need to make it. You're no longer handcuffed to your table to make money. And the reason, just in case you're wondering, I like the CA trainer more than I like hiring another associate, is the cost. You can get a trainer, a really good trainer, to work for you for about 20 to 25 bucks an hour. I think most chiros expect more than that, you know? I've even seen, I was talking to somebody maybe 2 months ago, and they pay 1.5 times minimum wage, which is super low. I think a lot of people, if you're willing to provide training and education to that trainer, they'd be willing to work for you. Some as low as minimum wage. I think that we overestimate how much people need to get paid. And much like you have probably spent a lot on education, people value education a lot. So if you lay out an education plan for the next year, they're more than likely to jump on it and say, I'd love to do it, right? So I hope that was useful. I hope this is interesting. This is Dr. Josh Satterley saying, go out there, maximize your license, and live the life you dream of. Thanks, everybody. Have a great one.
Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there to get more videos just like this.